you've already heard from her, but I thought I'd say a little bit more about your research, Maria. So in addition to the role of Vice President of Population Health here at our institute and co-director of our Institute for Implementation Science, Maria, you've spent your career leading participatory community engaged intervention and implementation research to develop, evaluate, implement, and disseminate interventions to improve health and health equity. Her research focuses on chronic disease prevention and control among underserved populations in the US and globally. And she's received numerous awards, including the Association for Schools and Programs of Public Health Research Excellence Award and the UTHealth President's Scholar Award for Research Excellence. It is my pleasure to invite you to talk on a practical approach to planning implementation strategies.
Hi again, everybody. So it's just such a pleasure to be among the presenters today. As you can see by the program, we have an amazing lineup, and today's kickoff was just fantastic. So thanks again. And I'm going to touch on some of the points that you heard earlier. I'm going to focus on talking about a practical approach to planning implementation strategies, and I'm going to talk to you for about 10 minutes, but if you want to hear more about some of these topics, there are lots of opportunities to do so, including short courses and collaboration opportunities. So we welcome to do that. Dr. Rogel touched on this issue that we have in the field of implementation science, which is that while we're striving to close this research to practice gap, the rapid growth of the science as a research endeavor has caused some concerns that paradoxically seems that implementation science might inadvertently replicate some of that research to practice gap that it was designed to address, right? And so we have to be cautious to not let that happen, because if we do let that happen, if we continue to make things so complex, right, that they're not usable in the real world, right? And this conference, a sub-theme of this conference and a theme of the conference in Nigeria is everyday implementation, right? How can we take what we learn, the lessons learned, the science of identifying factors that influence implementation and sustainment, and the processes by which that we use to develop implementation strategies to improve and accelerate that process, how can we make it useful, but usable and feasible, right? And it's a challenge, and I'm not going to give you like the answer today, but we're going to talk a little bit about some of those challenges and some processes that I think are getting us closer. Probably still not there, but getting us closer. So just so we're all on the same page, implementation strategies are methods or techniques used to enhance the adoption, implementation, sustainment, and scale up of a program or practice. And when we use the term evidence-based interventions, I think you all probably know that we mean things that can range from clinical interventions to packaged programs, even policies. And we know that there are sometimes discrete strategies to help get those used. And there's also and probably more commonly, multifaceted strategies. Now, multifaceted strategies, and I think you saw some examples with Dr. Rogel's presentation, multifaceted strategies are typically needed because we have multiple levels that the interventions address and multiple levels of implementers and implementation contexts that need to be influenced in order for things to get adopted, used, and sustained. So there's been a tremendous amount of phenomenal work in the area of implementation strategies. And much of that has been led by Byron Powell and Enola Proctor in that group. And there's been a number of taxonomies, and probably the one that's most widely used, and you heard Dr. Rogel refer to it, is the ERIC strategies. That stands for Expert Recommendations for Implementing Change. And so this team presented a consolidated compilation of discrete implementation strategies. And this was based on a review of over 200 sources and came up with these 68 implementation strategies and definitions. And the compilation has since been refined and with experts looking at it and using various methods to try to come to a common terminology when we talk about implementation strategies. So it was designed from looking at what's out there. What are people currently doing? So, and it's really helped the field tremendously. I was lucky enough to participate in this conference that Byron gave about a week ago, and it was sponsored by the Swiss Implementation Science Network, where he talked about the science of implementation strategies, and he sort of talked about where are we and what's currently happening. It was just a really nice overview. And one of the things that caught my eye, because I was thinking about this conference, is that the ERIC strategies are increasingly being used by low and middle income countries, but their application is inconsistent, and there's seldom aimed at testing the impact of those strategies. And this is an area where we have a huge gap, right? We talk about strategies. I'm going to tell you a little bit about planning strategies. But we really don't have a lot of evidence about which strategies and which strategies work for what. So, you know, another thing that they found in this review was that, and a recommendation was that future research should better specify strategies and assess their impact, right? And Enola Proctor in 2013 talked about and suggested that we specify strategies in this way by naming the strategy, talking about the actor, the action target, you know, the dose, all of these things. And if we do this consistently when we publish, then we're going to be able to learn a lot more about what works and what works for what. So most people agree that when we're developing implementation strategies, we need basically two broad things. We have to do two broad things. We have to conduct an assessment of factors. You've heard a lot about context already. What in the context influences whether or not implementation is going to happen? What are the barriers and facilitators to implementation? And then once we understand that, then we develop and design strategies. Well, I know that when we talk about practical implementation science, then we want to try to keep things simple, but there's also a danger there. Right? We should try to make everything as simple as possible, but not simpler. And I think that some of what we've seen in the field is people are trying to make it too simple. So now that we have these compilations, we're just sort of looking down the list and we're saying, oh, this one looks good, right? Well, where else in in public health or in research do we do that? We don't. We're much more systematic in thinking about, well, why would we choose this? And how should we operationalize it? So, just sort of a warning that as we try to be pragmatic, we run the risk of being too simple and thus wrong. So I wanted to highlight this phenomenal book that's already won 2 awards, and it's led by our next presenter, Kara Lewis, and also Brian Weiner and Kenneth Scher. And it's called Practical Implementation Science. And the goal of this book is to take those learnings into practice and to make them digestible and usable. I was lucky enough to participate in one of the chapters on understanding barriers and facilitators for implementation science that was co-written by Laura Damschroeder and also Bijal Balasubramanian. And we highlighted some sort of key steps and processes for this part of developing implementation strategies, this part which is identifying barriers and facilitators, understanding your context. And one main thing that you've already heard about is involving key stakeholders at multiple levels. This is really critical, not just for identifying what those barriers and facilitators are, but since we can't do everything, prioritizing them, right? Prioritizing what we're going to focus on. Also using both qualitative and quantitative research and data to understand an in-depth understanding of those contextual factors. So it's not enough to name them. We kind of have to understand how are they influencing implementation? What's the mechanism through which they're getting in the way of things getting adopted and implemented, or if they're facilitators, how are they actually helping? And one of the things that we do in this chapter is that we recommend these sort of core processes. So a little bit to answer Dr. Ledoux's question about, oh, what do we do with all this, complexity of theories and frameworks, right? Hopefully, these processes provide a little bit of guidance there, right? I think, first of all, I think of theories, models, and frameworks as tools. And I think that one of the reasons that people get really overwhelmed with them is because they feel like they have to follow them, to the letter. Do you say that in English? To the letter? Yeah. And so but if we think of them as tools that help us understand, I think that helps, sort of take away that pressure or that fear. And these core processes that we talk about in this chapter help you think about theory and use it in that way, but also use other ways of knowing, because theory is just one way of knowing, but there are other ways of knowing, and then organizing those in logic models. So I'm not going to go through all of these sort of core processes, but they really stem from work that was done with intervention mapping, and sort of adjusted or adapted for this context. And what they are is a set of helpful actions or tools that can provide a systematic way of identifying the potential barriers and facilitators to implementation. And they include like brainstorming potential barriers and facilitators. Usually when you bring a planning group together, they have experience. And if you're using team science and bringing people that are also part of the community, then it's a good place to start. But you don't stop there. Then you use theories and frameworks, you collect new data, and you prioritize the most important and changeable factors. And of course, community engagement and co-creation, that has to happen all along this path. It's practical to have a process. It's practical to use theories, models, and frameworks. This is a famous quote by Kurt Lewin that said, "There's nothing so practical as a good theory," right? And that's because it helps us sort of, what was that? What was the title of the article by Laura, from madness to out of the chaos, right? And to practice. And so we want to be able to sort of start talking the same language and have a framework for understanding what we're seeing and what we think could influence. So determinants, models, theories can help in these ways. Let's speed up a little bit. And of course, it's practical and I would say critical to engage communities and stakeholders, because we know that this is a fundamental way of knowing. And when we talk about community engagement in the context of implementation science, we're not just talking about patients. Of course, they're very important, and community members, but also we're talking about those implementers. And then the second part, so that was a little bit about assessing barriers and facilitators to implementation and understanding context. And then there's developing or selecting and tailoring strategies. And those of you who have known me and know sort of my work and have seen other presentations, it's not going to be any surprise to you that I'm going to talk for a moment about implementation mapping. So implementation mapping comes from intervention mapping. And some years back, this was an article that I was not involved in, where they talked about we need better methods for designing and tailoring implementation strategies. And they mentioned a few, and one of them was intervention mapping. And they talked about it as a way of going from understanding what the problem is to designing a solution, right? To designing that strategy. And while intervention mapping always included this planning of implementation strategies, so intervention mapping is a process for planning multi-level health promotion programs. And while it always included this step that talked about implementation planning, I realized that the implementation science community did not really understand that and know that. And so that's when we wrote this book, and we have several of the co-authors, including good friend and colleague from the Netherlands, Gil ten Koor, who you'll be hearing from later, that co-authored this. And it just had a tremendous amount of uptake in the community, which told me that it was a real need. It filled a gap in systematically thinking through things like, how do we use theory? How do we use evidence? How do we use new data in order to plan implementation strategies? And so essentially that's what it does. It sort of takes these different areas and ways of knowing and takes you through systematic steps to come out with actual strategies. There's a special topics issue of implementation mapping and frontiers in public health that features its application in different settings and different contexts around the world. These are the tasks. And one of the things that I think, again, making it simple, right? Taking a complex process, a lot of different ways of knowing, and then making it simple, is that it's asking these series of pretty straightforward questions, right? Who has to be involved? What do they have to do and why would they do it? What influences them? You know, how do we influence those objectives now that we understand what they are? And Dr. Irasola talked about the theory of change. So how do we identify that theory of change, those mechanisms to influence outcomes? And of course, is it working? We're going to be coming out with this paper soon that Tim Walker and Young Kang and others are collaborating on, which is how we can use implementation mapping logic models to help specify mechanisms of action. You're going to hear a lot more about mechanisms from Dr. Lewis, and also how to plan in a more simplified way, but taking into consideration all of these things that we've just been talking about. This is also a way to sort of understand when people are talking about forms and functions of implementation strategies, that's sort of where they lie. And so I think that processes like this can actually address some of what we've called for in terms of enhancing the impact of implementation strategies. We talked about this as Byron Powell and I and others in an article and also in this chapter in this textbook on advancing the science of implementation across the cancer continuum, that these are things that we really need to do. And I highlighted in red the things that I think that processes like the ones I just described can help us do. It can help us design and tailor, specify mechanisms, improve tracking and reporting, and help us conduct more effectiveness research. So I'm going to sort of just wrap up. I know I'm out of time. We want to make the planning process and the product, that implementation strategy itself, practical. And these are some things that we need, right? We need contextual awareness. You know what's out there. We need stakeholder involvement. We need resource optimization. Nothing's going to happen if we don't have the resources to implement it and sustain it. We need simplicity and clarity in how we communicate and flexibility and adaptation of our strategies. We need to be able to measure objectives and evaluation and communication and documentation. And I said, you know, simplicity is not the same as practicality, but the simpler we can make this process, the better. Thank you very much.